I work at Mayo Clinic in Rochester, Minnesota. So I've been with Mayo for close to 30 years. So most time I started to work as a nurse practitioner in BMT, the inpatient setting, about 2002. For the last 15 years also, I've been working in the outpatient in the multiple myeloma outpatient clinic as a nurse practitioner. So I have a passion in education as well. I just stepped down from the program director role last year, but previously, I was the program director to actually help our institution to develop the hematology APP fellowship. So I'm also an associate professor at Mayo School of College of Health Science. I'm actually very honored to be accepted to participate in the ASH MEI workshop in 2017 as the first non-physician medical educator. Back then, I was selected as the program director to help our institution to develop a new hematology fellowship for advanced practice providers. ASH MEI faculties provided invaluable mentorship to help our fellowship curriculum development. Dr. Marshall was the medical director of our new fellowship at that time, who also attended ASH MEI previously. Under the support of Dr. Marshall and our hematology leadership, we conducted a needs-based assessment to survey the NPs and PAs working in hematology and BMT at Mayo Clinic. And through the survey, we identified the knowledge gap and also the learning needs of our APPs to help us build our fellowship curriculum. I presented an abstract of this needs assessment project at ASH annual meeting in 2018. We published the article in the Journal of Oncology Practice. We also published another article to share our experience of new fellowship development in JETPro. Our former assistant program director, Jessica Shelley, presented the fellowship curriculum at one of the ONS annual congress. So the Mayo APP Hematology Fellowship is one of the pioneer programs to provide hematology specialty training for APPs. ASH MEI helped us raise awareness of the needing for APP fellowship through our presentations and journal publications. So since the launch of our program, the concept of APP fellowship in cancer care has been widely accepted across the nation. Many institutions have now developed their own APP fellowships over the past few years. Well, I would say the complexity of care and also highly specialized practice are probably among the main challenges, especially for the newly graduate APPs. We know that most NP and PA school trainings are concentrated in either primary care or internal medicine. They provided very limited education in hematology-specific education or BMT education. So there's a big knowledge gap for newly graduated APPs coming to work in hematology and BMT in such a highly specialized area. So this is the main reason we developed our hematology APP fellowship at Mayo Clinic in 2017 to provide a comprehensive 12 months training to our APPs who would like to work in this specialty. To myself, I think highly specialized practice is also a rewarding for me to work as an APP. I see patients coming to Mayo Clinic from all over the world, actually. It's really rewarding to have the opportunity to work side by side with those world-leading physicians in my daily practice. Yeah, I think patient education and support are the keys. Nurses working outside hematology specialty can still educate their patients and their families about the disease nature, what are the symptoms and signs to monitor for, and what are the risk factors associated with the blood cancers. Patient education can increase the awareness of blood cancers and therefore leading to early diagnoses and starting treatment earlier for the patients to improve outcomes. Yeah, actually, I would say thanks to the ongoing research, there have been significant advancements in blood cancer treatment in nowadays, such as CAR T cell therapy, T cell engaging bispecific antibodies, checkpoint inhibitors, antibody drug conjugates, and many other novel targeted therapies. So more and more treatment options are being available. I work mostly with the patients with multiple myeloma. With all the new treatment options we have nowadays, the prognosis of multiple myeloma has significantly improved compared to 2 to 3 decades ago. So working in hematology at Mayo Clinic, I have the privilege and opportunity to see those patients enrolled in a variety of clinical trials and also have the opportunity to engage in clinical research projects. So as advanced practitioners, we always stay informed about the latest clinical trials, newly FDA-approved agents, the updated clinical practice guidelines to ensure a high quality of patient care. So I'm really excited about, at least in the multiple myeloma world, to see how many new treatment options being FDA approved and what are the emerging treatment and clinical trials down the road. Provide me like a great opportunities, to provide patients and family with the education. So every time patients newly diagnosed with disease or the disease come back, is a big discussion in terms of standard of care versus clinical trials, the pros and cons, and help the patients to develop individualized care that optimize the patient care to improve outcome. There are so many advances, in treatment. Nowadays we're talking about, like a few months later will be different. That's the exciting part. New things are coming. But overall, I think, the Blood Cancer Awareness Month is a really great time to enhance the global awareness about the hematological malignancies. I honestly, as an advanced practitioner myself, every September, I feel like it's a special month for self-reflection and to remind me about my role and my personal experience with the patients who are fighting against blood cancers. And I truly feel grateful, to work in this specialty and to collaborate with all other healthcare professionals to provide multidisciplinary cares to our patients. So this month really reminds me the impact we as advanced practitioners can have on patient outcomes through their cancer treatment journeys.